My name is Andrew.
I'm also Andrew.
And we're the co-founders of HairDAO. My name is Andrew.
I'm also Andrew.
And we're the co-founders of HairDAO.
Okay, so where do I even begin with this one? So get this, we have these two dudes, Andrew Baxton and Andrew Verbinin, right? I guess we'll just call them the Andes, who founded this cryptocurrency project that is supposedly trying to find the cure to male pattern baldness or female pattern baldness. We also call this androgenetic alopecia. Already it sounds kind of odd because, well, I mean, what's the point of using cryptocurrency for this? I mean, the purpose of this cryptocurrency project, HairDAO, is also to raise money for research, but also, in their own words, to replace a government organization in the United States of America. This would be the National Institutes of Health, an organization known for funding scientific research. But if we're going to be honest here, why use crypto? Why not create some sort of non-profit and then just call it a day? What is this HairDAO organization really up to? Well, I think it's best that we start with another example from history, where ambition and innovation collide with ethical boundaries and realistic capabilities. For this, we need to take a look at the now defunct Theranos company and its founder, Elizabeth Holmes. Holmes, a charismatic young entrepreneur, founded Theranos in 2003 with a mission that was easy to rally behind: to revolutionize the healthcare industry by making blood tests simpler, faster, and cheaper with just a few drops of blood. This idea was groundbreaking and promised to democratize access to medical testing. This vision attracted nearly $1 billion in investment and brought together a board comprising of very powerful and influential figures. Holmes used the credibility of her board members, renowned for their backgrounds rather than their actual expertise in biotechnology, to bolster her company's legitimacy. She had venture capitalists in her pocket like her neighbor Tim Draper and Dixon Dahl. She also received heavy support after Larry Ellison, the co-founder of the Oracle company, invested heavily in Theranos. And her multitude of influential investors don't only stop there. She also had the Walton family, Rupert Murdoch, and the DeVos family, which all contributed millions, drawn by the promise of a healthcare revolution. Even prominent government figures, such as secretaries of states, like the late Henry Kissinger, and even George P. Shultz, also supported the venture. They brought along other notable personalities like William Perry and James Mathis. Additionally, Theranos' first board member was Stanford professor Channing Rex Robertson, Holmes' former professor. With all of these influential people, families, and organizations, is it any wonder how, despite having no viable technology or research, Theranos was able to garner massive amounts of support, be it from the financial backing of institutions, as well as, for a period of time, the media? This is a classic case of reputation laundering, where an individual or organization covers up unethical or criminal behaviors by engaging in highly visible positive deeds. They do this to bolster their public image and distract from their questionable history, some of which may be hidden. By 2013, after a decade of secretive development, Holmes revealed that Theranos secured a partnership with Walgreens, the second largest pharmacy store chain in the United States. And this eventually catapulted the valuation of Theranos to $9 billion. It was here Elizabeth Holmes was lauded as a visionary, gracing magazine covers and accumulating wealth and fame. However, the bigger they are, the harder they do indeed fall. Because things came crashing down in October of 2015, when journalist John Carreyrou of the Wall Street Journal revealed that Theranos used conventional blood testing machines for most tests, contradicting the company's claims. This expose led to further investigations, uncovering falsified test results and regulatory evasions, resulting in Holmes being charged with wire fraud and conspiracy to commit wire fraud. In January of 2022, Holmes was convicted in the Northern District of California. She was then sentenced in May of 2023 to 11 years in federal prison and ordered to pay approximately $452 million in restitution. In January of 2024, the Department of Health and Human Services Office of the Inspector General announced her exclusion from participation in federal health care programs for 90 years, justified by the duration of her fraudulent acts, her incarceration, and the significant restitution amount. Now, let's consider the HairDAO project. It's an intriguing concept, right? Using cryptocurrency to fund research for curing baldness, but similar to Theranos, the premise still raises serious questions about the viability and transparency of their claims. While Theranos promised revolutionary blood testing technology, HairDAO leverages blockchain networks in the crypto space. But for what purpose exactly? Okay, so the steel man of their argument, if we are to make it stronger and take them seriously, is that the use of crypto would potentially introduce transparency in the funding allocation and research progress. But I think that's honestly wishful thinking, because it also complicates the already changing field of medical research with fluctuating values and regulatory uncertainties. Look, the fact remains, the crypto world is largely unregulated. The United States Securities and Exchange Commission, also known as the SEC or the SEC, has repeatedly flagged questionable funding applications in the crypto space, raising red flags about projects like, well, HairDAO. A simple search on the internet reveals numerous cases where crypto-based companies have faced some serious backlash in regards to, but certainly not limited to, misappropriation of funds, lying to investors, and avoiding regulations that typical financial companies would have to adhere to. Listen closely, because I want to make this point clear. I think what makes this even more egregious is when regulations placed by the United States Food and Drug Administration, or FDA, are completely sidestepped for monetary reasons. You see, HairDAO seems to have flouted these regulations by funding, well, I want to get this clear, so let me say this as clearly as I can, illegal human clinical trials. No, I'm being serious. They've funded illegal human clinical trials by one of their lead online personality internet researchers known as Jumpman. We don't know the guy's name, but that's what he calls himself. It's a weird name, but maybe he's a big fan of Michael Jordan. Who knows? Well, anyway, they organized the creation of a drug that is a derivative and the active metabolite of DMT, known as Harmine, specifically Harmine 19A, which is classified as a psychedelic and controlled substance by the US federal government. And for this, they've supported the black market distribution of this chemical, and also created some very questionable scientific documents claiming that unapproved chemotherapy drugs could grow hair on bald scalps. Now, that sounds ridiculous out loud, but I assure you, that is the case. Okay, look, one has to wonder, why didn't HairDAO opt to become a non-profit organization? Nonprofits would better suit their mission, providing transparency, tax benefits, and more stable means of raising money for research. As a nonprofit, at least in the United States, HairDAO would have to file Form 990 with the Internal Revenue Service, also known as the IRS, which provides detailed information about their revenue, expenses, and how funds are allocated. This form is publicly available, allowing anyone to audit and scrutinize their spending. This transparency ensures that funds are not misappropriated and that donors can see exactly how their contributions are being used. Moreover, if HairDAO's goal is to replace the NIH, that being the National Institutes of Health, in funding hair loss research, it is really important to note here that the NIH provides grants with the expectation of advancing scientific knowledge, not generating profit. These grants fund research at private companies, research labs, and universities, focusing purely on scientific advancement without the burden of profit motives. But now HairDAO wants to be an arm of that? I mean, it looks like they just want to make money, right? So instead, HairDAO operates in the murky waters of crypto, where funds can easily be hidden in offshore accounts and on the blockchain through various wallets. And really, this choice merits tons of scrutiny. Yeah, it's that dark, but I'm sure you're curious for the next part, aren't you? Well, stick around because we're going to dive headfirst into what HairDAO is, how they operate, and what they're up to right now. So, with that being said, are you ready?
We always talk about like kind of turning everyone into a researcher.
Our primary objective is effectively to be a hyper-efficient factory for intellectual property generation.
People who are like buying those drugs on those DTC companies, but they don't do research, you'll upload your hair loss treatment data, your genome, and then photos of your head, and you'll receive hair tokens for doing so.
For better or for worse, cryptocurrency is a rapidly developing landscape. Regulatory bodies are often far behind in keeping up with the changes in this space. And in this series, we will be focusing on a specific crypto project, HairDAO. But before we begin, we need to do some quick glossary work on what the meaning of a DAO is, and while we're at it, what is or who is HairDAO? Okay, so firstly, a decentralized autonomous organization, also known as a DAO, spelled DAO, is an organizational structure enabled by blockchain technology. Unlike traditional companies or organizations, a DAO, ostensibly, operates without any centralized leadership. Instead, it relies on smart contracts, which are self-executing bits of code stored on the blockchain that dictate the organization's rules and facilitates operations. Decision-making within a DAO is perceived to be democratized, with governance typically distributed among token holders. So those would be the cryptocurrency representative of a stock in a company. In this case, the HairCoin token. And these token holders vote on proposals to guide the DAO's activities. So, depending on how many hair tokens you have for HairDAO, you could decide what the DAO would essentially do in a democratic voting process. For every one vote, there's an allocated one hair token. But more specifically to the case of HairDAO, co-founded by Andrew Rubinin, the Chief Investment Officer of Foster Cove Capital, a cryptocurrency venture capital, and Andrew Bax, the Chief Investment Officer of Byzantine Capital, yet another cryptocurrency venture capital firm, this DAO's mission is to supposedly revolutionize the funding and development of hair loss research, a field it believes is severely underfunded by traditional organizations such as private companies and even public funding from government entities. HairDAO specifically operates in the decentralized science or the DeSci sector when it comes to DAOs. And this prompts the HairDAO project to claim that being decentralized allows them to expedite hair loss research, and this essentially gives them an advantage in replacing the National Institutes of Health, or NIH, when it comes to funding research for alopecia, more specifically androgenetic alopecia. And it offers a seductive vision, a seemingly faster, community-driven research initiative that could potentially speed up the discovery of new treatments or cures. But as we'll soon uncover, all of this came at the expense of medical ethics, because you see, HairDAO had recently orchestrated and conducted an illegal clinical trial on humans. This clinical trial, approved by no government agency of any kind, encouraged the administration of unapproved chemotherapeutic medications, as well as the metabolites of the controlled substance DMT. And look, as crazy as all of this sounds, all of this was done because the founders of the cryptocurrency project wanted to see if the combination of an odd set of 20+ random drugs being used concurrently would somehow lead to hair growth on the scalps of balding men. And yeah, I know, I had the same reaction you're having right now when I was first approached by members of this project who were complaining to me about being banned from the subreddit Dressless, one of the world's largest online communities where hair loss sufferers discuss alopecia. As we will uncover through the actions of their so-called lead community researchers, HairDAO's approach has shamelessly disregarded both scientific rigor and medical ethics, in favor of exploiting these desperate men willing to risk their health on unverified and dangerous treatments. This project epitomizes a blatant disregard for honesty, safety, and really common sense. It preys on individuals who feel abandoned by traditional pharmaceutical companies, all while circumventing federal regulations to save money, a luxury that any legitimate biotech company cannot afford because, well, that's pretty damn illegal. On November 2nd of 2022, the official X, formerly Twitter, page of HairDAO announced in a now archived post that Jumpman, a pseudo-anonymous, self-taught biologist, chemist, dermatologist, and pseudo-intellectual Swiss Army knife of a man, had joined HairDAO as a member of their research and investment team. You see, this is significant because HairDAO attempts to distinguish between contributors, community researchers, and qualified academics who engage in proper clinical trials.
There's kind of like three types of members, if you will. They're like super passive ones, so like people who are like buying those drugs on those DTC companies but they don't do research. They're like people who are kind of like in the channel and chime in, but they don't kind of go the whole 10 yards. And then there are people who are like I was saying, like literally try drugs on themselves and like also a few traditional researchers who we also have on board.
However, as we will reveal, these distinctions are merely a facade, because I want you to remember that concept of a DAO, a decentralized autonomous organization. How could things be decentralized yet somehow have a hierarchy baked into it? What I'm arguing here is that there is some sort of centralization occurring that was able to pick this so-called pseudo-anonymous online researcher Jumpman to become what co-founder Andrew Rubinin mentioned in the official HairDAO Discord server as being a, quote, working group member, unquote, on the HairDAO research and investment team. So let's get this part clear here. This Jumpman guy is part of the core team, and the core team includes working members such as the co-founders, Andrew Rubinin and Andrew Baxt, as well as esteemed academics like Dr. Claire Higgins of the Imperial College of London, as well as Dr. Ralph Poss of the University of Miami. Jumpman had the responsibility of overseeing research funding and creating budgets to manage project funds. In the HairDAO quarterly investor reports, Jumpman is mentioned nearly 200 times as the central researcher, so you can't really say this guy isn't important to their operation. He clearly is, and when it comes to compensation, he has the most hair token points out of all researchers. And these hair tokens can potentially be converted into real-world fiat currencies like yens, euros, and dollars. So to make this as clear as possible, HairDAO hired this Jumpman guy, and Jumpman became a very integral part of this operation. So now let's fast forward to September 17th, 2023. While Jumpman was an active member of HairDAO, he created a Reddit post on the Trestless subreddit publicizing a group buy. Now, a group buy or group buying, also known as GB, is a crowdfunding method where people pool funds together to purchase items from a vendor. Once the funding goal is reached, a middleman collects the money and forwards it to the vendor, who then distributes the items respectively to participants based on their contributions toward a specific item. So in this group buy that Jumpman and HairDAO led, participants pooled funds to purchase 23 drugs, including some unapproved and untested chemotherapy drugs from Jenny's Chems, a black market chemical lab depot based in China known for producing fentanyl and anabolic androgenic steroids. On October 23, 2023, Jumpman posted about the group buy in an anti-aging online forum known as the rapamycin.news website. 8 days later, on the 31st of October 2023, he published the same group buy on the Hair Loss Talk forum utilizing an alternate username known as Pegasus2. Jumpman would go on to funnel people into various Discord servers and Telegram group chats, all co-signed and operated by HairDAO. Don't get this mistaken, this isn't Jumpman doing it on his own. HairDAO gave the means, supported Jumpman, and participated in this particular illegal human clinical trial. These individuals, many of whom have generalized anxiety disorders and a distrust of traditional pharmaceutical companies, gave their full faith and trust. Now, you're probably wondering, how could they have been convinced so easily? Well, there's a single document that appears to have persuaded these desperate hair loss sufferers, and this would be the Jumpman Cure Protocol. Now, I don't want to get into this too much, but I have to cover this part real quick. The Jumpman Cure Protocol is an experimental approach to treating hair loss created by, well, this Jumpman guy on the internet. It's primarily focused on two distinct strategies, the first being the wound-induced hair neogenesis, also known as the WIN protocol, and the second being the reversal of hair follicle miniaturization, also known as the RHFM protocol. When looking at the WIN protocol, we can take note that it involves using controlled microneedling to create micro wounds on the scalp, followed by the topical application of specific drugs that, according to Jumpman, would in theory modulate biochemical pathways like the Wnt signaling pathway, which in many cells and tissues is important for cellular growth and operation. In hair follicles, this pathway is important for hair to grow, but also its dysfunction is implicated in hair loss. Anyway, the second protocol involves reversing hair follicle miniaturization, a key feature of androgenetic alopecia being either male pattern or female pattern baldness. In this condition, hair follicles shrink over time due to the action of dihydrotestosterone or DHT, a hormone derived from testosterone. You see, normally DHT binds to these things in the hair follicle called androgen receptors, and it triggers biological reactions for people that have the genetics for hair loss, and it makes these hair follicles smaller and weaker over time. This eventually leads to complete baldness in specific areas. The model Jumpman proposes also includes the use of chemical agents for these androgen receptors, where blocking them, such that DHT can't attach to them in the hair follicle, should be able to potentially recover and grow better hair. And Jumpman claims that this process that he created can work synergistically across multiple biological mechanisms to both promote new hair growth and restore miniaturized hairs to their full size. But I want to be real here and ask the biggest question. Is any of this shit true? Well, you see, Jumpman doesn't provide any citations for his research. Typically in a scientific paper, whether it's done by an amateur like Jumpman or a professional, some form of citation is expected. Citations are crucial because they enable readers to verify the sources of the data and interpretations. This allows for peer review and cross-checking, potentially catching any misinterpretations made by the researcher in question. Furthermore, if we had citations provided in the protocol, we would be getting transparency, which would allow us to see where Jumpman's ideas originated from. Even the most esteemed scientists need to cite their sources to justify their claims and speculative theories. The process of standing on the shoulders of giants underscores that every new discovery builds upon previous knowledge, making citations is an essential part of the scientific discourse. When evaluating the effectiveness of a treatment, especially one intended as a drug or a therapy, conducting clinical trials is essential. The clinical trial process involves 3 phases, with each progressively more rigorous and requiring increased scrutiny of the treatment. Before entering these phases, treatments are typically tested in preclinical trials using animals or cell models to assess safety and potential efficacy. In Phase 1 clinical trials, the treatment is often tested on a small group of individuals to evaluate its safety and determine safe dose ranges. It's here that side effects may be identified. Phase 2 expands to a larger group of people with the targeted condition to assess the treatment's efficacy and further evaluate its safety. By Phase 3, the trial includes an even larger population to confirm its effectiveness, monitor side effects, and compare it to commonly used treatments. For any treatment to be approved in a clinical setting, the double-blind, placebo-controlled studies are considered the gold standard because they help eliminate bias and provide the highest quality of data. The risk of severe side effects increases with the number of chemicals involved, and interactions between these chemicals can be harmful, with consequences that need to be thoroughly evaluated. And it's for this reason that the clinical trial process, at least in the United States, needs to be overseen by an ethics board and approved before they can even be conducted. Each clinical trial is assigned with a unique code, often referred to as its ethics index or approval code, which indicates that the trial has been greenlit by specific government entities. And this code serves as a proof that the trial meets ethical standards and has received the necessary approvals for the relevant regulatory bodies. So, in the United States, these clinical trials must comply with the regulations set by the Food and Drug Administration, also known as the FDA, and must be overseen by an institutional review board, the IRB. And the IRB is responsible for ensuring that the study is ethical and that the rights and welfare of the participants are protected. So, given a proper clinical trial approach, it's virtually impossible for Jumpman and HairDAO to understand how each drug works and its safety profile, or if any of the drugs reduce the effectiveness of other drugs within this protocol. You see, the use of a combination of 23 different chemicals to treat hair loss by unqualified, unsanctioned biotechnicians is quite frankly outrageous. Because you see, there are a number of combinations in which these drugs could potentially be harmful, and if, let's say, there is to be any way that these drugs could possibly grow hair, you would have to ask the question, which drug out of the 23 drugs that you're using at the same time is actually responsible for that? Let's try to wrap our heads around the enormous number of possible combinations. It is practically impossible to determine which specific combination might be effective, and we can compute the number of combinations that Jumpman would have to test out by using the binomial coefficient formula. So when you actually put the numbers into this formula, you get 2 to the power of 23 minus 1, which equals a staggering 8,388,607 different ways to combine these 23 chemicals into non-empty groups. And a non-empty group is essentially a collection of combinations that contain at least one item, or in this case, at least one chemical. So when we're trying to test for things like safety and efficacy, I'm just gonna put this short. These guys have no real means to actually check for that. If anything, I would argue that there's more room for severe harm than any positive for hair growth. Each combination of chemicals has its own unique potential for interactions, mostly negative and possibly, maybe on the ever so slight chance of it being positive, but I don't think that's been substantiated through Jumpman's research, which we will see later on in a different segment. Also, we have yet to consider the possible impurities that may exist in these chemical compounds, especially with these experimental chemotherapeutic medications sourced from black market labs in China. A critical aspect of manufacturing pharmaceutical drugs is sterility. And this is basically ensuring that the pills or solutions are free from contaminants like bacteria and other forms of life. Another essential factor is quality assurance, which involves consistently producing drugs with the correct mixture of ingredients. Now, black market labs earn their name by producing illegal substances primarily intended for illicit use, often without adhering to strict standards of cleanliness and quality. Usually, compounding pharmacies and general pharmaceutical companies have their facilities inspected by government agencies like the FDA to make sure that these facilities are in good condition. So what I'm trying to say here is that impurities in the drug-making process results in harms that are often a risk in and of itself, aside from the active ingredient of the drug. So imagine a situation where the active ingredient of, let's say, a pill has its own side effect, and then, because of how this pill was created, it could be cut with a toxic substance like lead, mercury, or even arsenic. Anyone that may use that pill may be left with side effects on multiple fronts that could potentially be life-threatening. And we don't even have to imagine much, because Jumpman and HairDAO saw this firsthand when members of this botched, illegal human clinical trial came forth with strange reactions to these substances. And look, I'll touch on this on the next segment, but I'll have to say this, right? One of the most horrific reactions that I've seen from this illegal human clinical trial conducted by HairDAO and Jumpman would be one of the group by members reporting that, well, they seem to have gotten blood in their semen after using TM5614. Yeah, it's that wild.
They weren't even asking questions. It was just like blind obedience, blind faith in this guy.
It's like a cult.
Yeah, it's like a cult. It was totally like a cult.
Did Jumpman even try to get these things tested?
No. Anyone who brought that up was immediately dismissed or insulted, or there was sort of this jingoistic attitude, like your patriotism was being questioned if you even brought up testing.
There was another person that got blood in their semen.
But Jumpman designed this chemical that's derived from harmine, that's very toxic.
They got a rash from some sort of impurity that was in the ketoconazole powder.
There's some chemical that I think was related to blueberries or something, and so it's dyeing people's scalp red.
Sorry for the anticipation in the previous episode. And if you're watching this current part for the first time, it would be best for you to catch up with previous installments before continuing this segment, as you need some additional context to understand what's going on here, because things are very much out of the ordinary. In the previous episode, we discussed how Jumpman and the core HairDAO team facilitated the purchase of illicit drugs and unapproved chemotherapeutic medication for the use of an illegal human clinical trial. Now, we're going to dive into the group chats where many claims of side effects and requests for participant compensation occurred. Okay, so now we're going into the Telegram chats, where Jumpman and HairDAO included instructions to their illegal human clinical trials. For their participants, quote-unquote patients, as Andrew Bax would call it.
Because like Andrew was saying, we have patients who really care.
And these instructions included how to purchase the list of drugs within Jumpman's hair loss cure protocol. This included a phone number along with a link to the black market lab that would be producing these illicit drugs, such as Harmine 19A, which is a derivative of the active metabolite in DMT that causes psychotic episodes. By the way, I think I've said this in other parts, but DMT is a federally controlled substance, and in order to get its psychoactive effects, it needs to be broken down by the body. Also, it should be stated that Harmine is very neurotoxic to the brain. So the fact that they're just sending this out to people, some people who are in the United States, this is just a completely crazy operation. Oh, and I think I almost forgot. They told the lab to produce chemotherapeutic medications such as vemurafenib, sapanisertib, dimetinostat, decitabine, and the one that researcher Ralph Paus, along with Andrew Bax, Andrew Verbinnen, and Jumpman seem to love a lot, TM5614. They seem to specifically mention that those that buy the chemical TM5614 will have their blood work paid for at the expense of the HairDAO team. In the following screenshots from their Telegram group chat, you can see Jumpman mentioning how data from this illegal human clinical trial will be harvested and submitted through the HairDAO private patient portal. The HairDAO core team even goes on to create a Google document that contains the approximate cost of blood work if all of the chemicals are used from Jumpman's cure protocol. Now, again, who's the doctor that's overseeing this particular clinical trial? Because there's a screenshot on HairDAO's X, formerly Twitter page, that literally talks about Dr. Ralph Paus of the University of Miami wanting to look at the TM blood data. Not only that, but what I think is more essential is that if we go to an interview where the HairDAO team co-founders Andrew Verbinnen and Andrew Bax did with Molecule, another cryptocurrency project in the DeSci space, the HairDAO founders actually admit that this sort of patient database is meant for researchers to use to expedite their research process.
What else that's like pretty unique here is the patient portal that you guys are working with. This idea, as I understand it, is that, you know, a patient is sort of compensated for handing over their genomic data.
So we kind of view like pharma like through early drug development through three pillars, and we think like we can hit all three of them with the patient portal. With the preclinical R&D, what you do there is you essentially leverage big data to try to find new gene targets. So like we've already had requests from Ralph and other researchers, like one of Ralph's, for instance, was to look at strong family histories of balding and strong family histories of great hair. In terms of the clinical trials, that's actually a lot easier. Like we can, like probably in our next version, we'll have a list of where all of our members are and where they're willing to participate in clinical trials. So instead of like this fragmented marketplace that exists today, we can, if you're running a hair clinical trial, you can come to us and we can give you the patients.
So the HairDAO organization is attempting to sell pools of patients. It seems as if they're leasing out patients currently under HairDAO's care. While it would be one thing if they were contractors for a pharmaceutical company and they were tasked with finding patients through, say, a sign-up process, HairDAO seems to be suggesting that they can lease out people who are currently receiving their experimental treatment. This approach disturbingly resembles inadvertent human trafficking, given that their business model seems to involve selling access to experiment on other people. That's kind of crazy. You can't run an illegal, unethical human clinical trial that no sort of government board signed off on, and then give that data to clinical researchers. Listen, I thought we learned our lesson from World War II when it came to this sort of unethical harvesting of quote-unquote patient data. And I can't overstate how much this TM5614 compound was important to not only sell, but to get these desperate balding men, many of which who have anxiety disorders or other sort of mental conditions, to use it on themselves. HairDAO required this blood data for those that were buying the chemotherapeutic medications. And this TM5614. Looking at their official Discord server, the HairDAO founders talked about quote-unquote reimbursing the TM community. But you see, eventually all hell seems to break loose when some of the chemicals from Jumpman's cure protocol is shipped out from the black market lab in China to their respective group buy members. Now, I have to note that many of these chemicals are coming in powder form. So these group buy participants have to essentially mix the powders themselves in either isopropyl alcohol or in a substance called DMSO. Now, DMSO should not be played around with because whatever it's mixed with can cause it to easily penetrate through the skin and reach the bloodstream at a high concentration. Some chemical compounds, due to their chemical properties, can only dissolve in DMSO. That being said, people need to be very careful when using DMSO in conjunction with particular substances that can cause harm if a good deal of the substance is immediately delivered through the skin and into the bloodstream. And I think that would be very essential when it comes to chemotherapeutic drugs that haven't been tested in humans. I don't know, maybe. Perhaps you, viewer or listener, can tell me if I'm overreacting here. When observing the happenings of the Telegram group chat, it appears that these powdered chemicals may have had impurities, as one of the members reported getting sick after using an antifungal, ketoconazole. Now, I find this really strange because ketoconazole can be purchased over the counter in many countries at a 1% concentration, with the most popular consumer brand being Nizoral ketoconazole shampoo. Additionally, higher concentrations of ketoconazole, shampoos, or solutions may be reliably obtained from a doctor and a compounding pharmacy that is FDA approved. So why these guys would get it from a random black market lab in China is very odd to me, because really it only invites danger. And it did. This member of HairDAO's illegal unapproved human clinical trial ended up getting a severe rash. And Jumpman, I guess to his credit, was informed and immediately alerted all of the participants to discard their ketoconazole powders because the representative of the black market lab, Jenny's Chems, a lady only known as Olivia, found that the powder ketoconazole batch contained impurities that could be making people sick. And don't worry, Jumpman assured everyone that this same black market lab that already gave them some messed up powdered chemicals would be sending out new ketoconazole powder next month containing hopefully no impurities this time. Listen, I don't know about you guys, but this is crazy and very absurd. I would think that people would have the foresight to avoid using these powders from this group buy and from this lab after such a blunder. Again, this is the many reasons why this whole group buying process is dangerous, and also why there needs to be some sort of foresight from a government organization like the FDA or the IRB. Because even though these people have chosen to be part of a clinical trial, they need to be assessed to see if they have the proper mental faculties to understand what they're doing to themselves, and also in case of the researchers themselves actually know the potential side effects, and if they're not unnecessarily putting these subjects, these people, into harm's way. Oh yeah, that's right. And then there was that guy that warned everyone that he got blood in his semen after injecting TM5614. Okay, that's absolutely fucking insane. How could you just... I don't even know what to say. How can you just say, oh, I got blood in my semen, everyone, and then just alert people as if this is something normal? Why would... Guys, I'm gonna have to break character here and jump out of the screen for a second and ask the audience, what would you do if you took a medication and then, you were doing something and then that thing led to the release of a particular substance and you saw blood in it? This guy saw blood in his semen. What the f? Excuse my language, but seriously, that is absurd. And Jumpman responds by essentially saying that maybe, just maybe, the guy took too much TM5614 chemical and this is what could be causing the blood to be in his semen. What? As if it's just a casual thing? Listen, this is why this whole HairDAO group buy nonsense, this illegal human clinical trial, is just absurd. What makes this whole thing especially egregious is that HairDAO operation, this crackpot operation, by and large, was preying on men who may have had general anxiety disorders, body dysmorphia, and even in some regards, potentially autism. Now, I'm not just saying that as some sort of a joke. I think in this particular screenshot on the screen right now, you can clearly see that it's from the group chat. But it goes to show the amount of false information and unsubstantiated science that the HairDAO group was willing to feed towards these desperate men. Here you can see Jumpman saying that a chemical compound known as ABBV CLS7262 may have the potential to cure autism. Oh yes, Jumpman in all of his wisdom is able to cure autism. Now, the ABBV CLS7262, or I'll just call it AbbVie for short, is a drug developed by the AbbVie and Calico Life Science Corporation, a subsidiary of Alphabet, the parent company of Google. And this particular drug aims to treat diseases associated with aging. It's specifically being explored for its potential in the field of immuno-oncology as well. It should be noted that immuno-oncology focuses on harnessing the body's immune system to fight cancer by targeting and modulating specific biological pathways, again, many of which that influence aging. But all that being said, the drug is by no means FDA approved. However, it's under investigation for certain conditions like Alzheimer's disease, amyotrophic lateral sclerosis, or by what many of you guys may know it by as ALS, and general disease that involve the reduction of white and gray matter in the brain. And look, Jumpman saying that it can cure autism, this thing is completely unfounded like I said before, but it goes to show how these guys are just playing on the emotion of these desperate, balding men, who many of which have stated they have some sort of generalized anxiety disorder or even autism itself. You see, it's all a part of this whole scheme to lure in these people so HairDAO can experiment on them. It's grossly unethical, very, very unethical. I don't even know how they got this far, to be honest with you. So after the debacle of bloody semen and suspicious rashes from maybe a chemotherapeutic agent as well as an antifungal, members of the group buy group chat became rightfully concerned with individuals calling for Jumpman to have these chemicals tested at a third-party lab. It appears that the HairDAO and Jumpman coalition seem to have favored a specific chemical testing lab known as Genoshik. And to the suspicion of many members, it seems that whenever another lab is recommended aside from Genoshik or New Mega, Jumpman became notably avoidant and combative. A concern that many members in the group chat had is related to Genoshik's reputation. The Genoshik testing lab is run by an individual named Jano. After following a link from the group by members, the destination leads to a thread on a website known as Think Steroids, a website dedicated to anabolic androgenic steroid use and performance-enhancing drugs. So let's temporarily follow that link and look into why Genoshik might be seen as unreliable. The story begins with the user named Mant, who sent samples of human growth hormone to Genoshik for testing.
I got home and took a look at it, and wow, I opened it and looked inside. To my amazement, the package and 3 growth hormone vials were in the pack, right where I put them. Wrapped up in the 2 Band-Aids I put them in, with all the contents that were in the package I sent.
Janoschik claimed that the package was held up in customs and later returned to Mans, unopened and in the same condition as it was sent.
I just checked and the package seems to have been stopped by customs. Would you please describe the package completely to me, please? So I can decide if I should try picking it up or if it's too big a risk.
And this raised suspicion about whether the samples were tested at all. So this Mans user accuses Janoschik of lying about the testing process and providing false results. Janoschik defends himself by explaining that customs had caused issues and his girlfriend had to return the package to avoid legal trouble. Jano maintained that he conducted the test himself, but it seems that he did not communicate this properly due to various complications, I guess you can say. Mans would say, quote,
"Why would you take the package back down to customs after being called to return it? Just tell them you tossed it. Oh, but you were out of town and your girlfriend took it. If they threatened you with arrest, why would they give it to you in the first place? LOL."
Unquote. This raised doubts about Jano's claims of custom issues and testing. 4 members saw Jano as lying for several reasons. Jano's story about customs and the return of the package was seen as implausible and inconsistent, because he initially claimed that customs had taken the package, and later it was returned unopened, which seemed to be contradictory because usually customs would open the package and check what's actually in there because, again, if they're concerned about it, that's what they're going to do. Mans pointed out that Jano was adamant about whether a real address was used, which seems suspicious. Members felt that this was an attempt by Jano to create an excuse for not conducting the tests. Jano said, quote,
I tested number 17 3 times. 5.2 milligram was the average result. A vial from your kit was 5.27 milligram. So it seems that you consistently get lower results than me, and I am very confident in my results.
Unquote. This interaction was viewed with suspicion by forum members. Additionally, Jano claimed that he had his girlfriend return the package to customs, so now things are just becoming very convoluted. Did he test it or not? Did customs seize it, open the package, and then send it back to the customer Mans? What's going on here? Because honestly, it looked like people concluded that he just didn't test it. Jano didn't test any of the chemicals that were sent to him. Now, is this the type of person you want to be testing your chemotherapeutic medication or your ketoconazole shampoo? Powder? It just seemed very out of the ordinary that Jumpman would choose a very unreliable, random guy to test these particular chemicals, when in reality, Jumpman can just send it to a more professional lab than just some random guy in his basement. So, Jano from Janoschik is well known for being unreliable and possibly having relationships with certain people to the point where he might provide fake results. And this understandably sparked concern among some of the HairDAO group by members who were also test subjects. The substances they have could contain hidden impurities that pose significant health risk, aside from the actual chemicals themselves. And we can see that there was further suspicion because Jumpman and HairDAO consistently pushed another chemical testing lab known as Numega. Group by members questioned why it was always the case that they seemed to push specific labs and not others outside of these 2 particular chemical testing laboratories. Okay, look, with these additional details, we might be getting a bit too sucked into the particulars of HairDAO and Jumpman's insanity, so let's refocus on a key detail. A co-founder of the HairDAO project, Andrew Baxt, posted in the HairDAO official Discord server that obtaining patient biometric data from all those using Jumpman's cure protocol chemicals is essential. This includes a reimbursement for those who bought the specific compound TM5614. Telegram messages from Jumpman and the co-founders show a clear effort to push the sale for these certain drugs. And Andrew Bax, this co-founder of HairDAO, at one point on the server mentioned that Jumpman's actions have saved the HairDAO projects millions of dollars. And these are expenses they otherwise would have to incur had they been running a legitimate human clinical trial. Instead, they chose to break the law. So that's the end of this part, but don't worry because I actually interviewed somebody who was a part of this group buy. And I think they have a lot of things to say about the unethical behavior of both Andrew Baxt, Andrew Rabinin, and overall the HairDAO project, but mostly the craziness and insanity, along with an esteemed academic university researcher who may unfortunately also be implicated, maybe inadvertently, working with Jumpman on this particular illegal human clinical trial. So with that being said, are you ready for the next part? Because I know I am.
He was like a Nobel laureate in chemistry. He just figured everything out, and anyone who didn't believe him was an idiot, and he was going to fix everything.
We're not even separating the patient and the researcher because they're actually both a part of HairDAO. There are really no middlemen. It's a very circular economy that we think we've already demonstrated can be self-sustaining.
A common defense tactic used by those running supposedly decentralized organizations, or DAOs, is to claim that anyone can contribute. They often attempt to draw a distinction between the actions of the core team, that being those who lead, found, and often incorporate the project as a business in some country, and then the random community members who are supposedly contributing independently. However, as demonstrated in earlier segments, this is simply untrue. In my messages with Andrew Baxt, he not only threatened to sue me, but also claimed that HairDAO has no connection to this Jumpman's illegal activities. He argued that anyone can do whatever they want when contributing to DAOs. Yet, the evidence contradicts his claims. Because, well, you see, investor reports posted by HairDAO mention Jumpman nearly 200 times. In fact, he's repeatedly praised as the lead community researcher. Additionally, the co-founder, Andrew Rabinin, made several posts on Twitter and the official HairDAO Discord clearly identifying Jumpman as a working group member of their research and investment teams. HairDAO also operates a leaderboard that tracks the members' contributions and rewards them with hair points or hair tokens, which can be redeemed for real-world fiat currency. So in this system, essentially, these people, these sort of quote-unquote independent members, are functioning as employees that are being paid for their quote-unquote contributions, which really is essentially their labor.
We can issue you $50 worth of hair for doing a small task force.
You know what? Just take it from Andrew Baxt himself, who has already acknowledged this illegal human clinical trial in one of his real-life presentations, where he alludes to the fact that people in the HairDAO organization have taken to launching what is essentially decentralized science's first clinical trial. I want you, the audience, to pay attention to the language that he and Andrew Rabinin uses in the next set of video clips. They call these people in their illegal human clinical trials as patients.
On the research side, because like Andrew was saying, we have patients who really care. And also hair loss is much more topical, so it's not like something kind of like psychologically, it's not really something in your body, right? People are willing to do things that maybe they wouldn't for other diseases. So like there are people in our community who will order drugs on Alibaba, like mix them themselves at home and apply them at home. On the clinical trial side, like our members would pay to be in clinical trials. The way traditional biotech works is usually big pharma pays a clinical trial placement person to like query a bunch of doctor databases and they try to find someone.
Now, if they're patients, then who are the doctors that are overseeing them and monitoring their health? Because, well, I really hope it isn't Jumpman. Ah, okay, I see. I think I'm beginning to see the picture here. HairDAO wanted cheap data to inform their clinical trial studies, so they facilitated Jumpman, their lead unqualified researcher, with the means of commissioning Jenny's Chems, a black market lab in China, to create drugs that Jumpman theorized would help regrow hair. Am I getting it right? I think that's what the context is here, huh? The data, specifically the TM data that Andrew Baxt talked about on the HairDAO official Discord server, helps inform the HairDAO project as a whole to make more quote-unquote informed clinical trials if they ever choose to go through a more formal clinical trial process. This helps reduce their operational costs, so in other words, they broke the law to essentially run an informal clinical trial because it would save them a quick buck. Profit is clearly a motivating factor here. HairDAO is not an alternative to the National Institutes of Health, despite claiming that it will replace it. The National Institutes of Health grants money to scientific studies without the expectation of making a profit, but rather to advance scientific research. HairDAO, on the other hand, brazenly breaks laws at the expense of gaining data that can help them reduce their own overhead expenditure when it comes to the formal clinical trial process. You see, typically researchers test on cells and animals first, but HairDAO ignores these initial safety screening processes to expedite their research. This research could be used in what they hope would be essentially new treatments or cures for hair loss that they would obviously attempt to patent. This isn't only unethical, it's actually not feasible at all. HairDAO would still have to go through a formal clinical trial process set forth by the FDA. Also, depending on the drug that they're trying to push through clinical trials, HairDAO would either have to file for what is called a 510(k) clearance or a new drug application, also known as the NDA. The 510(k) clearance is a pre-market submission made to the FDA to demonstrate that the device or drug to be marketed is safe and effective, as well as substantially equivalent to a legally marketed device. So this process is generally quicker and is used for devices or drugs that are not entirely new or significantly different from the ones that are currently approved on the market. Now, the NDA, or the New Drug Application, is a comprehensive document submitted to the FDA that contains all the data and information necessary to approve a new pharmaceutical for sale and marketing in the United States of America. The NDA includes data from preclinical and clinical trials, proposed labeling, safety updates, drug abuse information, patent information, and any data from studies conducted outside of the United States. This process is rigorous and ensures that the drug is safe and effective for its intended use. Now, considering how many of the drugs in Jumpman's protocol lists are not approved, discontinued, and or not under any formal use of any kind, and yeah, I'm looking at you, Harmine 19A, the DMT derivative that Jumpman is supposedly claiming can grow hair? Anyway, aside from that ridiculousness, if HairDAO was looking to model their own drugs based on these experimental chemicals, they would still have to go through a clinical trial process before they could properly market them. This is a huge lapse in judgment, likely driven by the eagerness to obtain a profit. HairDAO claims transparency with funds they raise and brags about their efficiency. However, they also mention that these funds come from tax havens like the Cayman Islands, which, to be honest with you, already sounds shady. Especially considering that at the time of recording this video, the HairDAO project has only been live for around a year, yet has reached a market capital of $70 million US. Look, just because we can see cryptocurrencies and their transactions between wallets and that, this thing is indeed visible, it doesn't mean that there's true transparency here. You may know the wallet address involved in specific transactions, but you don't know who owns what, or if there are any points of centralization. The centralization renders the idea of a decentralized autonomous organization useless, because at some point you can get some people or one person using a series of wallets to kind of make it look like there's more people in the trade, when in reality there's just a central point of command, like in any traditional organization. HairDAO seemingly encourages people to buy into their company by purchasing shares of their hair token, after exchanging it for Ethereum, or by completing certain tasks to earn this token. And this is essentially a payment. Those who buy into this process are assured of further transparency. As HairDAO states on their website, quote, "Members are able to verify their hair holdings and the DAO's trail of funds in real time and at zero cost. The entire hair loss community can always verify that the DAO is acting in their best interest." Unquote. However, HairDAO would become more transparent and efficient by simply becoming a charity. Because non-profit organizations in the United States of America, where might I remind you HairDAO is based, are required to adhere to strict disclosure rules regarding their funding sources and expenditures. This transparency is mandated by the Internal Revenue Service, or IRS, through Form 990, which ensures that donors and stakeholders have a clear view of how funds are managed and utilized. It's actually pretty simple. All a contributor would need to do is use the IRS tax-exempt organization search tool on the IRS website, and they could then audit the contributions to a specific charity organization. Furthermore, donations to a hair loss charity would be tax deductible. It would be easier for a charity to raise money when there are tax benefits for both the charity and the donor. These benefits include the ability for donors to deduct their contributions from their taxable income, which can provide significant savings come tax season. This tax incentive encourages more donations as individuals and corporations alike can reduce their tax liability, all while supporting a cause they care about. Additionally, charities themselves can be exempt from paying certain taxes, or any tax altogether, allowing them to use more of their funds directly towards their mission rather than, well, on tax expenses. So here, a non-profit organization would gain greater legitimacy and trust from the public and potential donors. Non-profits are subjected to extreme oversight by the IRS and must adhere to strict regulations, ensuring that funds are used appropriately and that the organization operates transparently. This oversight includes annual reporting of financials, program accomplishments, and you have to have some accomplishments, and governance practices through the Form 990, which is available for public inspection. Moreover, operating a charity would require the charity itself to establish a clear mission and demonstrate how they are working towards achieving it. This could involve setting specific goals for hair loss research, collaborating with reputable scientists and medical institutions, and also providing regular updates on progress to their supporters. By aligning with established medical research standards and practices, such a charity would enhance their credibility and effectiveness in the fight against hair loss. But, you know, HairDAO says that government institutions like the NIH are inefficient with how they fund research. And, you know, the irony here is that HairDAO is really inefficient with their funds. And you don't even have to take my word for it. Their co-founder, Andrew Verbinen, mentions on their Discord server that they put too much money into Ethereum and in general in the crypto space. And if you know anything about the cryptocurrency space, these assets are very volatile. So all it takes is for a significant crash, which would really hinder their ability to operate and fund their own studies. So that's kind of like shooting yourself in the foot while you're walking. Just ridiculous shit. So with all of this in mind, why would anyone ever feel the need to do this in crypto? Look, cryptocurrency spaces like decentralized autonomous organizations or DAOs would further complicate the issue, as we already are seeing with this illegal human clinical trial that, really, HairDAO's lead researcher Jumpman conducted. Bottom line, people are operating away from sensible regulation. And when this happens, you tend to get crazy shit like this. But also, for you as an investor or a potential investor, this kind of behavior puts your investments at risk. Jumpman isn't working with her. HairDAO laundered the reputation of Dr. Claire Higgins after commissioning her to do work on some human cells. In this segment, I want to focus on HairDAO and some of the outright lies that this project has made. The lies are tantamount to securities fraud violations, as they directly lie to the public and potential investors about key details. It also involves actual academic researchers, being Dr. Claire Higgins of the Imperial College of London, as well as Professor Ralph Paus of the University of Miami. Like, gee, where do I even begin with this one? Well, if you remember in the previous segments, Jumpman, while acting under HairDAO, commissioned Jenny's Chems, the black market lab in China, to create all of those experimental chemicals. You know, the unapproved chemotherapeutic chemicals along with the psychedelic metabolite of the controlled substance DMT known as Harmine or Harmine 19A in this case. In the case of Dr. Claire Higgins, she is a lecturer in bioengineering at Imperial College of London, specializing in tissue development and regeneration using hair follicles as a model. She completed her postdoctoral training at Columbia University where she received a Career Development Award from the Dermatology Foundation. Her research focuses on the interaction between specialized cells in the hair follicle to understand organ regeneration and skin repair. Now, Dr. Claire Higgins is especially relevant here because she is currently running experiments on human hair follicle tissue samples in a contract with HairDAO. Strangely enough, on the official X, formerly Twitter account of HairDAO, the relationship between Jumpman and Dr. Claire Higgins is stated in the following screenshot.
Twist 1, Inhibition. Jumpman's research advanced to the preclinical stage in collaboration with Dr. Claire Higgins. Our twist study is the first in modern history to be co-designed by an Anon and leading university researcher.
HairDAO, on numerous occasions, has published magazines on the website Issue where Jumpman and Dr. Claire Higgins are stated to be in collaboration in a study that was co-designed by Jumpman. My team and I decided to email Dr. Claire Higgins earlier this year to see if this was indeed the case and if the representations created by HairDAO were legitimate. Now, I'm going to show the emails here on the screen right now, obviously with her email redacted, but I have to say, it looks awfully suspicious. First, we presented Dr. Claire Higgins with the evidence regarding HairDAO's illegal human clinical trials. The emails with Dr. Higgins showed that Jumpman isn't working with her. I mean, she actively says that Jumpman isn't a part of HairDAO anymore, and she has no idea who Jumpman even is. But this raises some questions because how could HairDAO say that Jumpman and Claire Higgins are actively in collaboration, such that Jumpman is co-designing a study for Dr. Claire Higgins to conduct? And even at that, if Dr. Claire Higgins is saying something true here, she says that she doesn't know who Jumpman is, but she somehow knows enough to know that Jumpman supposedly isn't involved with HairDAO anymore? Some things here are starting to become very contradictory. This raises some serious questions about the legitimacy of HairDAO's claims and Dr. Higgins' involvement, highlighting the need for further investigation into the ethical and legal implications of HairDAO's activities. So, either Dr. Claire Higgins knows more than what she lets on and essentially got a prestigious university such as the Imperial College of London involved with Jumpman and HairDAO's illegal human clinical trials, or perhaps a more charitable interpretation is that HairDAO laundered the reputation of Dr. Claire Higgins after commissioning her to do work on some human cells, and then further exaggerated Jumpman's role, if he had any at all, in helping Dr. Claire Higgins. In any case, this omission of detail could be considered securities fraud, as HairDAO has seemingly lied to the public and prospective investors. Securities fraud, also known as investment fraud, occurs when a business entity makes false statements or omits important information about investments to manipulate investors into making decisions based on inaccurate or incomplete information, and this often leads to financial losses of those investors. It should be noted that this deception can take various forms, such as providing false information about a company's financial health or performance, engaging in insider trading, where someone buys or sells securities based on non-public material information about a company, and, of course, running Ponzi schemes, where funds from new investors are used to pay earlier investors, creating an illusion of a profitable investment. Transitioning away from these deceptive practices, HairDAO's own website content and promotional materials invite further scrutiny. They suggest that a community-driven approach to governing and funding hair loss research through mechanisms that ostensibly reward participations with the hair tokens for their contributions. According to their platform, these tokens are not only a means to vote on project directions, but also a way to earn by sharing personal treatment data, thereby integrating users into the very fabric of the research process. However, this integration raises profound ethical and regulatory concerns, as it blurs the lines between data protection and participant exploitation under the guise of innovation and decentralized governance. HairDAO's operations and the information presented on their website could potentially expose them to serious SEC violations, particularly if their practices involve misleading investors or misrepresenting the nature of their hair token. The Securities and Exchange Commission, or the SEC, is particularly vigilant about the way companies, including decentralized entities like DAOs, handle the offering and promotion of what could be considered securities. The Hair token is promoted by HairDAO as a means for governance and as a reward for participating in the DAO's activities, such as uploading treatment data or participating in governance votes. While HairDAO states that these tokens do not represent an investment or a promise of financial returns, the suggestion that holding Hair tokens could give users access to proprietary research data or influence over profitable intellectual property might be interpreted as an investment proposition. The SEC might view these tokens as securities if they believe that the token holders are led to expect profits derived primarily from the efforts of others, and this is a critical element of what is called the Howey test, and this is used to determine whether a transaction qualifies as an investment contract. HairDAO's promotional strategies and the substantial focus on the potential utility and benefits of the Hair tokens can be seen as an attempt to boost token demand and value indirectly. If HairDAO implicitly, especially explicitly, encourage the perception that these tokens will increase in value due to the success of the projects funded by the DAO or due to exclusive access to research results, these actions could be construed as offering an investment opportunity. This would require adherence to specific disclosure and registration requirements under the SEC rules, which, if not followed, constitute a violation. I find that it's a fair assessment to make that HairDAO is indeed promising financial returns. You see, the whole quote-unquote stake for alpha section of the HairDAO platform, as shown in the image on the screen right now, introduces a problematic element that could attract scrutiny from regulatory bodies like the SEC. This feature allows Hair token holders to quote-unquote receive confidential information, including early access to their research data, unquote, which in turn enables hair holders to earn more hair. This setup suggests that by staking their tokens, holders can gain access to valuable information that could presumably enhance their ability to make profitable decisions regarding further investments in hair tokens. The SEC often examines whether this is an expectation of profits primarily from the efforts of others when evaluating if an arrangement involves an investment contract and thus a security. The promise that staking the hair tokens can lead to earning more hair, especially when tied to the acquisition of exclusive, potentially valuable data, implies that profits could be expected. In fact, token holders staking their hair tokens gain additional hair tokens, which could be viewed as contributing to a quote-unquote common enterprise, and this is another factor that is used in the Howey test to determine the presence of an investment contract. And right over here, guys, this would contradict the notion of HairDAO being decentralized, because get this, the staking of the hair token to earn more hair token suggests that the increase in the token value or the ability to earn more tokens depends significantly on the managerial efforts of those running HairDAO, who control the research data and its dissemination. So if they have research that comes out that could potentially crush their project and make it go down to zero, well, if you have exclusivity to that knowledge, you can sell off your hair tokens when it's profitable, and then when that research comes out, well, you wouldn't be at a loss, now would you? Because right over here, HairDAO has not been cautious in how it markets and manages the hair token staking functionalities. This failure in doing so could potentially lead to significant legal and financial repercussions under the US securities law. And guys, similar cases have already happened. A DAO called Barnbridge was founded to have issued quote-unquote smart yield bonds, which pulled crypto assets from users and employed these assets in third-party lending platforms to generate returns. The SEC's intervention centered on the claim that these bonds were unregistered securities and that the operational structure of the pools constituted unregistered investment companies. This classification hinges on the presumption that the primary function of these pools was investment in securities, making them subject to stringent regulatory requirements under the Securities Act of 1933 and the Investment Company Act of 1940. This violation of SEC regulations resulted in Barnbridge DAO and its two co-founders agreeing to pay more than $1.7 million to settle charges with the SEC. Specifically, the Barnbridge DAO agreed to disgorge nearly $1.5 million of proceeds from the sales of its digital assets, and each of the two founders, Tyler Ward and Troy Murray, agreed to pay an additional $125,000 in civil penalties. A significant aspect of the SEC's orders is the implication that Barnbridge's pools, despite the decentralized and autonomous label, operated very much like traditional investment companies. And this finding is crucial as it sets a regulatory precedent that DAOs, irrespective of their decentralized claims, can be treated like traditional entities under the US securities law. That is, if their operations align with those of regulated entities like investment companies. And to be honest with you guys, it seems that HairDAO is following in the same footsteps as the Barnbridge DAO. We're going to be looking at the co-founders as well as their cryptocurrency venture capital firms. Have they discovered some sort of trading algorithm that defines conventional market wisdom? Somebody messed up on the math here. Perhaps we should question where the money's coming from. Now, in this segment of Crypto Bros giving balding men chemotherapeutic drugs and psychedelics so they can regrow their hair, well, that's kind of an exaggeration, but I mean, actually, it's not that much of an exaggeration, but anyway, whatever. We're going to be looking at the co-founders as well as their cryptocurrency venture capital firms. Believe it or not, they have those. So we have the HairDAO co-founder, Andrew Verbinnen, who happens to be the chief investment officer of Foster Cove Capital, a cryptocurrency venture capital firm that he runs himself. And then we have the other HairDAO co-founder, being Andrew Baxt, the chief investment officer of Byzantine Capital, yet another cryptocurrency venture capital firm, this time ran by Andrew Baxt. So for further insight, let's take a look at an article from Foster Cove Capital. This article states that HairDAO's goal is to solve hair loss by disrupting traditional funding for early-stage R&D and intellectual property generation, an area of the economy that the article states is traditionally funded by the NIH, a government organization that we've been talking about in previous segments. Almost by design, government organizations, as the article states, are incredibly capital inefficient and ripe for disruption. They go on to state that SpaceX disrupted space travel, along with private defense contractors like Anduril. To set the tone, Foster Cove Capital's article critiques government institutions for their inefficiencies in capital usage, suggesting that significant resources are wasted in the realm of research funding. In a previous segment, I highlighted how HairDAO isn't completely efficient itself, and that given the laws and regulations, it would make sense to simply create a charity of some kind where the organization cannot have its funds taxed as it attempts to directly raise money in more accessible means, all while becoming more transparent as an organization. Anyway, the article states that HairDAO aims to tackle these perceived inefficiencies in the hair loss research sector by proposing that the traditional roles of government in funding and regulating are ready for disruption. Ironically, they boldly compared their anticipated impact to that of companies like SpaceX and Anduril. However, these comparisons seem overly ambitious, and here's why. SpaceX and Anduril thrive with stringent regulatory frameworks. SpaceX works closely with NASA and complies with Federal Aviation Administration regulations to ensure safety and operational standards in space travel. Similarly, Anduril collaborates with the Department of Defense, adhering to national security regulations. In a stark contrast, HairDAO, as a decentralized autonomous organization, operates largely in unregulated cryptocurrency space. The Foster Cove Capital article, to be fair, acknowledges this reality itself when it comes to the uncertainty that DAOs face, particularly in relation to compliance with US Security and Exchange Commission, or SEC, regulations. This lack of regulatory clarity can pose substantial risks, leading to serious legal and financial challenges for both investors and the project's founders. Moreover, the pressing ethical questions and considerations regarding compliance with U.S. Food and Drug Administration or FDA standards, especially given HairDAO's ambitions in the medical research domain. Interestingly, the Foster Cove Capital article suggests that government regulations could enable the government to tax and benefit from DAO technology, because this perspective seems kind of contradictory. Because calling for regulations effectively subjects DAOs to the same constraints as traditional companies listed on the stock exchange. Under the Consumer Identification Program, or CIP, a federal law, anyone using DAOs and cryptocurrencies would need to be identified by the government to ensure security in these transactions. So to be honest with you, at this point, what makes these DAOs different from any traditional organization and company listed on regular stock exchanges? And again, what would necessitate the use of cryptocurrency in this case? I find it hard to give this project a purpose. Perhaps we should question where the money's coming from. And the spotlight now turns to Byzantine Capital, headed by the other HairDAO co-founder, Andrew Bakst. Now, this Bakst fellow seems to be, let's just say, interesting. I found some things hard to believe when reading their latest earnings report. Their 2021 annual letter makes one wonder. Have they discovered some sort of trading algorithm that defines conventional market wisdom? Or are they gazing into a crystal ball that Wall Street veterans can only dream of? To describe Byzantine Capital's 2021 performance as merely stellar is a gross understatement. According to the reports, they achieved a jaw-dropping return of 331.58% for that year. Now, to put that in perspective, Bitcoin at that time, the flagship cryptocurrency, saw a gain of only 61.18%, while the S&P 500, a barometer for the stock market, posted a solid but much lower, 26.8%. Since starting their firm in April of 2019, Byzantine Capital boasts an almost unbelievable cumulative return of 2,626.39%. Now guys, this is over 26 times the original investment in less than 3 years, an achievement that raises more than a few eyebrows in the investment community. To understand these extraordinary claims, it's essential to compare them with more grounded benchmarks. The National Bureau of Economic Research provides insightful analysis of private equity and venture capital firms. Their findings suggest that the idea of performance persistence, where top-performing funds continue to outperform, is largely a myth, particularly after the year 2000. This insight challenges the very notion that past successes can reliably predict the future results, a belief that many investment strategies are built on. And yet, Byzantine Capital's reported success seems to defy this logic. It seems that the Byzantine Capital firm outperforms consistently regardless of the volatile swings in the crypto market, which has seen dramatic rises and equally dramatic falls over the past years. The Byzantine Capital firm touts an average daily return of 0.59% and a standard deviation of 5.58%. Now, these figures paint a picture of a wild and unpredictable ride compared to the S&P 500's more stable 0.07% average daily return and 0.69% standard deviation. But why is the standard deviation an important factor here? And what does it tell us? Well, the standard deviation shows us the amount of variation in a set of values. In finance, it measures how the returns of an investment deviate from its average return. You see, when you have a higher standard deviation, this indicates greater variability in returns, which suggests that the investment price can swing wildly over a period of time. For Byzantine Capital, a high standard deviation of 5.58% indicates that their daily returns are very, very volatile. So this means that investors can experience significant ups and downs in the value of their investment on a daily basis. In other words, Byzantine Capital's returns fluctuate wildly day to day, and the S&P 500's movements are much more restrained. Moreover, Byzantine Capital boasts a Sharpe ratio of 2, an indicator of how well their returns compensate for the risk they take on. The Sharpe ratio quantifies the relationship between an investment's return and its risk. But something's going on here because Byzantine Capital's high standard deviation of 5.58% indicates significant daily volatility. For me, this would be a potential red flag for investors as it points to a greater risk of uncertainty in the fund's returns. And I'm smelling a huge inconsistency between the high volatility and their claimed strong returns relative to the risk, and it raises serious concerns in my mind. It's unusual, to say the least, for a fund to maintain such high performance consistently amid turbulence. So in other words, their Sharpe ratio doesn't really match the wild volatility that the standard deviation in their investment report suggests. Somebody messed up on the math here. He wanted this drug called decitabine to be used in his protocol, which blocks aspects of your DNA from being expressed. Both benign and malignant skin lesions occurred as a side effect during this treatment with this drug. So we're finally at the last part of this ordeal. You see, Jumpman's protocol and research might as well have amounted to searching up some random pathway that may be implicated in hair follicle regeneration and hair growth, and then attempting to go on Wikipedia and find some random chemical that either overexpresses that pathway or suppresses it and/or silences it. So in other words, he's pretty much just closing his eyes and throwing a dart at the board. Now, I've been talking about these chemotherapeutic drugs in Jumpman's protocol, so I'll finally take the time to introduce them quickly. These chemotherapeutic drugs, some still under investigation and largely unapproved, are vemurafenib, cepensertib, and dominostat. Vemurafenib, also known by its brand name Zelboraf, is a medication used to treat melanoma, a serious type of skin cancer that begins in the cells called the melanocytes, the cells responsible for giving skin its color, and with recent speculations and observations in animal models, potentially within hair follicles. Vemurafenib works by inhibiting or stopping a specific mutation in cancer cells called BRAF or BRAF V600E. This mutation causes the cells to grow and divide uncontrollably. Now, when vemurafenib blocks this mutation, it slows down or stops the abnormal cell growth. The BRAF V600E mutation is part of a larger signaling system within cells known as the MAPK pathway, which normally helps cells grow and divide. However, when this pathway is overactive due to mutation, it could lead to cancer. So by blocking this pathway, vemurafenib prevents the cancer cells from growing and eventually leads to their death, helping control the spread of the melanoma. HairDAO's illegal human experimenter, Jumpman, states in his protocol that, quote, application of BRAF inhibitor on days 2 and 4 post-wounding increases Wnt signaling and hair neogenesis, unquote, and that he will use vemurafenib on days 2 through 4 during his post-wounding. Jumpman also states that vemurafenib increases the FZD7 Wnt receptor expression, and this may result in him using it daily on his scalp. So guys, you don't need to be a scientist to know that you shouldn't be using chemotherapy drugs. First, if you aren't under the supervision of a doctor. And second, if you're getting it from shady and unapproved places on the internet, especially when you're getting it from a guy named Jumpman. It should also be stated that Jumpman is being reckless in his assertions and speculations, as they could only get someone hurt. Jumpman doesn't seem to realize that cancer cells are not normal cells. Therefore, we can't expect for drugs like vemurafenib to suppress similar pathways and increase others in normal, non-cancerous cell. In fact, I could only assume that vemurafenib potentially causes more skin cancers. You see, it is well known within the literature that chemotherapeutic drugs may cause certain cancers to get worse, or even at times for patients to develop new cancers. Unfortunately, this is a side effect of vemurafenib, as noted in the, quote, cutaneous side effects of BRAF inhibitors in advanced melanoma review of the literature, unquote, which is an academic article written by 2 scientists. The authors state that both benign and malignant skin lesions occurred as a side effect during this treatment with this drug, so you have to be very careful when using this. And the crazy part here, Jumpman is suggesting that you use microneedles, and after you've applied these punctures in your scalp, effectively exposing your body to the outside world, you then should sprinkle this chemotherapeutic drug on those wounds that you made, which would surely make that thing go systemic or into your body. This is not safe by any means. Sapanisertib and deminostat are two chemotherapeutics that are still in clinical trials. Their side effect profiles are unknown and potential drug interactions as well. Considering how Jumpman is using this alongside vimunafrenib on his patients, quote-unquote, which are just regular people, this is a huge issue because I can only assume that there are going to be some sort of weird conflicts between the drugs, and somebody can likely get hurt here. And guys, one thing that I thought was very scary about Jumpman's protocol was his attempts to induce cellular growth while taking medication that directly suppressed cellular death. In other words, Jumpman was attempting to create a hair loss protocol where cellular duplication was maximized and cellular death would be limited. This sounds like a recipe for literally cancer, uncontrolled cellular growth. And in fact, he wanted this drug called decitabine to be used in his protocol, which blocks aspects of your DNA from being expressed. This is extremely dangerous. I don't even know why he would go through this measure. And that drug decitabine in Jumpman's paper is only stated to be used in mice, so this is very, very weird. And I guess Jumpman seems to take the concept of mice and men to heart. Instead of fulfilling his plans of regrowing long-lost dead hair follicles, he might be chasing fool's gold here. Jumpman has applied knowledge from studies about mice, ignoring the significant differences in physiology and genetics between mice and humans. And then he's going to say that, oh, those studies apply directly to human beings. So he's pretty much using these human subjects who are paying to be in his clinical trial as guinea pigs. And another thing to note about mice studies is that they're largely not applicable to human beings because these mice are genetically modified to lack an immune system. And by lacking an immune system, it makes them more responsive to the manipulations that the researchers are doing to them. And this probably wouldn't work on real-world mice that are in the wild, let alone human beings. And to be honest with you, this is pretty basic knowledge. And the fact that Jumpman has gotten this far in performing an illegal human clinical trial with the help of HairDAO is absolutely insane. I mean, I get it. We all wish that there was better funding when it comes to scientific research from the federal government, especially for dermatological conditions like hair loss. However, HairDAO has already established itself as being anti-national institutes of health, and it seems like they're doing some very odd and shady practices. We can get an idea of this negative sentiment, in fact, by looking at University of Miami professor and HairDAO partner and researcher Dr. Ralph Paus, who may be found criticizing the NIH funding on the HairDAO video where he states that there's too many mice studies. Listen, cancer medications and cancer as a disease in general involves dysregulated cellular environments where at any point, at any moment, a single or a multitude of cellular pathways that control how a cell grows and dies may be upregulated or boosted, or downregulated or suppressed, causing random mutations. And guys, this was actually pointed out to Jumpman on multiple occasions. On his initial group buy post on the Trestless subreddit, here you can see Jumpman arguing with the Reddit user Jersey Seed, who claims to be a cancer biologist. Now, it is the internet and anyone can claim to be anything. They're pretty much anonymous, right? However, I'm more inclined to believe what Jersey Seed is saying here. Much of Jumpman's protocol makes use of chemotherapy drugs to grow hair. He has no knowledge of whether these chemicals are safe or what the established safety doses are. Nor does HairDAO and Jumpman have any proof that it would stimulate hair follicle regeneration or hair growth. Jumpman doesn't seem to even cite his sources in any of the publicly available documents. If anything, there's more proof of a protocol like this causing cancer. Instead, with all of his hubris, Jumpman arrogantly tells Jersey Seed that he's still quote-unquote wet behind the ears, and that essentially Jersey Seed has no idea what he's talking about and needs to go study more. Man, get a load of this guy, am I right? Now, I would like to remind you guys that these people in the HairDAO Jumpman clinical trial, the illegal human clinical trial that is, are buying these chemicals as powders and solutions. That is, they do not get these chemicals pre-mixed. This is important because this provides yet another variable to this illegal human clinical trial that the HairDAO core team members have conducted. I think that they should have looked at the FDA's regulations when it comes to human clinical trials and how HairDAO, under the guise of the quote-unquote greater good, and of course payments in the hair cryptocurrency and token investment, went along to encourage and source out the patient biometric data such as blood work in order to run this highly illicit operation. I guess the cherry on top comes in with Jumpman's protocol, where he essentially renders much of the 23 chemicals that he's pushing for people to use as essentially useless. Because finally, in all of his wisdom, he tells hair loss sufferers in this illegal human clinical trial that, quote, everything is theorized to work synergistically to create new hairs and reverse miniaturization, unquote. Jumpman then says that out of all the compounds, drugs like Deministat and Sepensertib, along with Harmine 19A, are able to grow hair on their own. Yes, guys, you heard it here first. Our internet hair loss genius thinks that using largely untested chemotherapeutic drugs and a derivative of the psychedelic drug DMT, all of this is going to make you grow hair. Sure thing. Well, let's just see what happens from here on out. There's nothing else to say. Let's see what happens. And hey, maybe I'm wrong. Maybe HairDAO will cure hair loss one day. Or maybe this scam, or what I think to be a scam, might go to zero. Anyway, thanks for watching this series, guys, and I hope it's been very entertaining for you. Sources to everything that I'm saying, of course, will be provided in the description. And yeah, things are getting pretty crazy online, but I've never seen anything crazy like this. See you on the next one. Bye, guys.
I don't think you can replace pharma companies. That's going to be pretty tricky. DAOs have struggled to do anything useful, so we're not going to be replacing drug companies anytime soon. Yeah, HairDAO sounds really cringe.